Hi, and welcome to another episode of Mythbusting here on the 5-Minute Check-In. I'm excited today. We have two very interesting topics to cover. And as always, I have my favorite guest here, Dr. Ankita Sagar, a Vice President for Clinical Standards and an Associate Professor of Medicine at Creighton University. Ankita, thanks for joining.
Thanks. Great to be back.
Two interesting subjects today. You are going to be talking about exercise and depression. A very interesting article came out. And I'll be responding to a big study that came out looking at some correlation of tattoos with lymphoma. So why don't we start with you, and why don't you give us a sense about this study? Very interesting work.
So a meta-analysis looked at 218 individual studies. Over 14,000 patients' data was reviewed. And the question they asked was, is exercise as effective or complementary to other forms of treatment for depression, including psychotherapy, antidepressants, or control, which meaning placebo or usual care? What they found was there was moderate reduction in depression symptoms with specific types of exercise that included walking or jogging, mild aerobic exercise, strength training, yoga or tai chi, and dance.
Dance. All right. I like they broke down all the different types of exercise.
Yeah, absolutely.
You and I were talking a little bit about this issue of accountability and how important that was in this study. Can you talk about that for a second?
Yeah, sure. So usually when we think about recommending exercise in clinical environments, we say you should exercise 150 minutes for an average healthy person over the week. Well, there's not much accountability where we say an average of 150 minutes over the week. Instead, what the study looked at was what happens if we prescribe a specific regimen that would work for patients, meaning Monday, Wednesday, Friday, you are going to do XYZ, and Tuesday and Saturday, you will do XYZ. And the next week, send me your log of how many times you're able to accomplish that goal.
So that's the accountability piece that we need to have our clinicians engage in that conversation with their patients. So dance is exercise in this study, right?
That is the number one takeaway. Dance is exercise. Okay. So when you are dancing in your bathroom, you are exercising.
So let's ask this question. Is it true that dance reduces depression?
It is true. Dance does reduce depression symptoms, as does most exercise.
So, Ankita, is it a myth that exercise reduces depression?
It is not a myth. It is the truth. Let's pivot to another study that's made a lot of headlines. Do tattoos cause cancer, specifically lymphoma? Dr. McGinn, walk us through this. Does it cause cancer?
This is a very interesting subject. At first, I thought, what's all the discussion going on in the media? But the more I dug into the topic and read this original article, I realized this is an important public health issue. 20% of folks in almost every country have tattoos now. And ink is a known carcinogen. So those are two critically important subjects that we need to address. So we have a very well-designed trial here to look at this subject.
What was the design of the trial and what makes it an important study to think about?
So in trials like this, where you're trying to define if an exposure, say at the age of 20, causes cancer when you're 50, it's hard to follow patients for that long. So what we end up doing are case control trials or these big cohort trials. So they did a very well-designed case control trial. About 1,300 patients known with lymphoma compared to about 4,000 patients without lymphoma, matched them up, compared them, showed there was an increased risk in cancer among the tattooed folks, about 20% increase.
Okay, so some increase in those with tattoos. When do you start to think about correlation versus causation, and does it apply here?
It's exactly the point of this study is a correlation study, not a causation study. We now know that tattoos have a slight correlation uptick for lymphoma, but we don't know if it causes that. The great example here that everyone always talks about is, hey, if I took a study and I studied everybody that carried matches, does that cause lung cancer? Well, it's correlated with lung cancer because matches light cigarettes you smoke, and you get the cancer. So you could mistakenly think matches cause lung cancer, but they don't. They're correlated with lung cancer. So we have to do more research here to find out if it's causative or not.
So is it a myth that tattoos cause lymphoma?
Well, it's not really a myth and it's not really true. It's somewhere in between, and we need to do more research to get at this correlation causation issue.
Okay. So it's to be determined.
TBD.
Okay. Well, thank you so much. And thank you to our audience for recommending topics. If you have ideas, send them over. We will happily include them in our next Mythbusters episode.